Welcome to Beyond the Press Release, a production of Agoracom, in which we take the time to speak with small cap executives after they put out important news. With us today, glad to have him back for the company's first interview of 2022. Matt Stang, CEO of Delic Holdings, trades in Canada under DELC. For friends of the US, DELCF. For those of you new to the story, the name probably tells you a lot, but to understand Delic, you first have to understand that psychedelics are going to go through a parabolic, paradigm-shifting growth curve the next 5 years because of their ability to treat anxiety and depression, amongst many other things. How big of a market could that be? Well, when our first interview with Matt in the middle of 2021, he said, I think it's $1 trillion opportunity a decade from now. And there's no doubt about that's going to be a massive market, especially considering the fact in one of their polls today, we've determined that $300 billion in lost productivity in the U.S. Due to anxiety, depression out of the economy. Delic is more than just your standard psychedelics company. It builds itself as a marketplace for the mainstream to access psychedelic wellness. It owns and operates an umbrella of related business. I love it. They're creating this network effect between their labs, where they focus on R&D, their ketamine infusion centers that are operating right now. In fact, they just opened up another one. We're going to talk about those. And even Meet Delic, the premier psychedelic wellness and edutainment event that took place in November in Las Vegas, 2,500 attendees, 2,000 plus calls to the clinics in just 2 days. So they're hitting it out of the park. And by the way, they have a current revenue run rate in excess of $9 million and is EBITDA positive. Lots to talk about. Matt, welcome back, my friend.
Thank you so much. What a lovely introduction. And it is super exciting to be here. And as you said, I think the wave we've talked about is really starting to show. You know, I think, like you said, we just put out a poll we conducted with the Harris Poll organization that just shows a very strong majority, almost a 2/3 majority of folks are interested in this psychedelic wellness if they can get it today. So I think it's really, it's a sea change. It's a a change in how people understand mental health and wellness, and I'm super excited to be bringing that to the masses.
And for those of you who haven't seen that study, let me give you some specifics because this is big. All right, a study found that today that was released, 65% of Americans who suffer from anxiety, depression, PTSD believe that psychedelic medicine should be made available to patients with treatment-resistant anxiety, depression, or PTSD. I mean, you and I often talk in the past, Matt, about acceptance by people who are suffering from these ailments. But because I always wasn't sure, they've all gone through traditional and hasn't been very successful, but that's what they know. And I was always wondering, what their uptake would be. This is a massive number. I didn't think the number would be. Did you guys expect to be that big, or did you guys always know along?
No, I think you always go out not really knowing what you're going to get back, and that's the joy of doing this, right? Is you really, like, we've got real data here. This is one of the most reputable polling companies in America did this poll, and it's showing that a 2/3 majority of folks are interested in this treatment, and not only interested but want it to be available now. So it's really, it shows just the huge amount of potential for this, and you look at the numbers like you talked about, there's hundreds of billions of dollars being spent on anxiety and depression and PTSD every year in this country. So if 2/3 of the people want it, that's a couple $100 billion opportunity, right?
Yeah, so and that's today. When you're saying it might be $1 trillion opportunity globally 10 years from now, you weren't kidding around, because some people might have thought that was tongue in cheek.
But that's just me believing it as a stubborn person who has pushed this into being. But seeing it from the actual people really changes that conversation a lot. So I'm just super excited to be a part of changing the world and mainstreaming psychedelic wellness. And that's,
well, I'd say that comes from a smart, stubborn guy, because you know your markets. So let's go to the next step, right? So you've got the potential solution. The people want it. And I'm going to read your quote here. We're witnessing a silent crisis impacting people across the globe, exacerbated by the pandemic. And the results of the survey should compel more medical professionals, lawmakers to support in-depth studies of psychedelic medicine. That's the next step. Now, where do you think, since you're so prescient on where things are going so far, where are we at with lawmakers? Where are we at with medical? professionals in their acceptance of psychedelics?
It's a great question. I think with lawmakers, there's a lot of motion happening this year. I know there's a bunch of folks working to get stuff on the ballot for the 2022 election. I think probably 2 states is my guess will have some form of psychedelic ballot initiative. And I've also, there's a ton of cities, municipalities, counties that are just going out and decriminalizing psychedelics just like that. They're just going out and doing it, right? And they're allowing people to make choices. When you talk about medical professionals, I think it's still, people are still waiting and watching and doing the thing that they do as scientists. I don't disagree with scientists taking a wait and watch
Sure.
and waiting for data, but I think the data is pretty clear. Like every bit of data input that we've gotten over the last couple of years has been, pretty magnificent on how much this helps people. So yeah, I think ketamine exists right now. We have the largest chain of ketamine clinics in America. So people can go to one of our 13 locations and try a ketamine experience for their treatment-resistant depression or their anxiety or their PTSD. And so that exists and is there right now and is producing a great deal of revenue for the company and will keep scaling as we open the next 18 clinics. I think that the other side of this is how quickly can FDA work to get the next tranche of psychedelic molecules approved for non-emergency consumption? Because right now, people, I don't know if you saw this, but Canada just legalized, Health Canada just allowed for doctors to request psychedelic medicine for their patients outside of the
No,
study.
I didn't know that. That's fantastic. That's great
So
progress.
now you're going to be able to get an exemption from Health Canada to treat someone who has a clear and abundant need for these substances, today, this week, this month. So that's already happening in Canada. We have our lab up in Canada that does that has licenses for psilocybin. So we're working on making sure that we have really good processes for people as they get into the place of being able to do these. I think in the U.S., the most likely way this will happen is MDMA and psilocybin will get some form of approval in the next year to 2 years. And those will be the things that come through the door next. And then there's a raft of probably 25 or 30 phase 2 clinical trials on DMT, 5-MeO DMT, ibogaine,
I don't even know
LSD.
what those are.
Those are just other
Right.
novel psychedelics that have. So ibogaine, what does that do? If you take ibogaine, you now shut off your receptors to drugs. So you are now no longer physically dependent on. So if you are a heroin addict, you go do an ibogaine treatment, you are no longer physically dependent on heroin. It's
How
amazing.
far are we away from something like ibogaine and all these other compounds coming out?
Well, I think 3 to 4 years probably. There's clinics set up in Mexico right now that a lot of people. I sent a friend there 10 years ago, and he got clean off of his opiate dependency. So it works. It's just not available in the United States yet legally. I think those things. When you say there's a opiate crisis sweeping the nation, and you have a substance that will stop people from being physically dependent on opiates, it makes sense to kind of work towards getting that legal so people can do that. I don't know how long that takes, because all of this comes down to, the cost and the time it takes to get a drug through FDA, right? It's tens of millions or hundreds of millions of dollars and years of work and tons of intricate data and control studies. So my feeling is on the doctor side, we will have more molecules in the next year to 2, and then a bunch of molecules in like 5 years, 4 years. You're going to see all of these substances that have medical benefits having some form of FDA approved.
And will that have to come from a company like Delic, or will it be more industry wide?
Yeah, I think it'll come from drug development companies. Those drug development companies will spend a ton of money and with a ton of hope that at some point it gets through. and then once it gets through, they'll probably get bought by a large pharmaceutical company because they'll be blockbusters. So, and then Delic will be the place that you can go. You'll have a clinic in your backyard that you go to for a psychedelic medicine treatment. And so, just like any other type of pharmaceutical, you go somewhere. If it's an in-person kind of thing, like the psychedelic therapy is, you go in, you get the substance, someone sits with you and walks you through the process and gives you that efficacy that you're looking for, and helps you change your mind and your life.
And that's the part that we should talk about, because the great thing about Delic is, the danger sometimes with companies that are R&Ding and developing is it could take years for them to get the revenue. And then, that's a lot of risk for investors. But in this case, what's great is you're creating that ecosystem. You got the R&D, you've got the big event, but the most important thing, the core, is you've got your clinics. Where are you at right now in terms of how many you've got open? And you said earlier that 18 more are coming, but where are you at in terms of how many are open right now?
Yeah, sure. So we're at about 13 right now, and we have 18 more on the way. So the idea is we are currently the largest chain of clinics in America, and to just keep that lead and really make it so that 60-70% of the population of the country is within a 45-minute drive. That's our long-term goal. Once we get to that 70 to 100 mark, we should be within a pretty close drive to 60 to 70% of the population. And
how long would it take? So, because people at home, including me, don't know how long it takes, to roll out one clinic, let alone to go from 13 to 100 or so. Ballpark, what does that rollout plan look like, Matt? And when you're there, is it safe to say you'll cover the four corners and the central part of America? So, like you said, a clinic will be nearby almost everybody.
Yeah. So in terms of how long it takes, I'll unpack the first part of that. It's we purchased Ketamine Wellness Centers in November and worked with them. The first opening was last week, so it took about 2 months to get the first of our new clinics open. We have a whole pipeline of them. If you look at deliccorp.com, you can see where the locations we're going to open. That's our next 18 months worth of openings. We got 15 kind of eyed for the next 18 months. The thing about it is, as we open more, we have more people to open more. So, it does get scalable. The scaling accelerates, right? So it allows us to scale that much more. When you ask, are we going to be four corners in the middle? We're going to be in places where there's a concentration of people. I don't think we're going to be in, South Dakota, right, where there's one person per 3 miles.
Right.
I think, we're looking at this as
Chicago, LA, New York, Dallas, Miami, like big centers, which everyone can get to anyways. I mean, literally, I know, we can't be in everyone's backyard, but you'll be readily accessible. The thing is,
you can be in 70 locations and still be within a 45-minute drive of 70% of the population, because that's most of our population in our country are in cities. So I don't necessarily want to go after New York and LA right away. I'm looking at Salt Lake City, Reno, Tampa, San Antonio. There's a ton of these large cities that are not the super expensive coastal cities, because we want to be accessible, we want to be affordable, and we want to make it so that psychedelic wellness is for everyone. And that's part of our strategy for rolling these out.
Yeah, I like that strategy. Magic Johnson actually did that a couple of decades ago, building a movie theater chain that he sold for a couple $1 billion. He built a movie theater chain in those secondary cities, stayed away from New York, LA, Chicago, Dallas, Miami, et cetera, and so on. So if it worked for Magic Johnson, I'm sure it's going to work for Matt Stang and Delic. By the way, how are those clinics going? I mean, I read off the numbers, so we know from a revenue point of view, they're going great. You're even not positive. But anecdotally speaking, when your patients come in, George comes in, he gets some treatment, he gets some therapy. What is the referral? Because the good news is from a patient point of view, you don't get to see George a whole lot more, right? Because you help him. But are the referrals flowing from that? Because George goes home and tells two friends or tells two friends?
Yeah, and one of the best things about this job is getting the reviews, right? So I get at least 5 times a week. I'll get a review that someone posts on Google that's just like, I couldn't imagine living my life. It was the worst thing ever, and thank God I
Wow.
went to uh, ketamine wellness centers in Houston, and it's blown my mind that I can feel normal again, that I can live my life again, that I can go to work without feeling like a dark cloud is over me and really feel like a human being. Like it's we had a veteran who was in last week who sent this beautiful like 3 paragraph review. I don't want to violate anything because it wasn't publicly posted, but
Sure,
just
sure.
stuff the stuff that people say is so like you're actually changing people's lives, which is so, I'm not selling a widget here, right? I'm not buying something in China and selling it for 3x and making a little bit of money on it. This is actually helping people live better lives, which is fantastic. And it is a real business. So I think those two things together really makes my heart sing. And I think anyone who can be an investor in this, that's part of the value in being part of this.
Yeah, that's a double bonus of being an investor in Delic. On the one hand, as investor, you have a strong business that's growing with a real plan of attack. And on top of that, you're making not only people's lives better, but Matt, do you ever extrapolate sometimes when you think about it and say, in this decade, you might be able to help X number of people, because if you go by the number of patients, but if you help George, it means you're helping probably 10 people around him, his wife, his kids, his mom and dad, because now everyone's less anxiety about George, people feeling better. You ever feel about what how big of a network effect Delic could have
Yeah,
just America for now, let alone the world?
actually, I did because we've looked back. We're doing some data analysis on what we've done before. So the clinics that we own have done about 80,000 treatments. So we're talking, by your numbers, about 800,000 people helped. That's a pretty spectacular number, right? And we're looking at that was with 5, 6 clinics that they had from 1 to 10 over the last whatever number of
Yeah.
years. So if we have 40, 50, 70, the amount of people we can help is just staggering. So
Yeah, you
it
talk
really
about
is millions of
hundreds of
people.
millions, literally. You might be able to get to the hundreds of millions at some point.
That's exactly what we're hoping for.
By the way, let everyone know, because most of us have never had this kind of therapy before. If when George comes into your clinic, he's a soldier with PTSD or suffering from anxiety, depression, ballpark, how many treatments does he or she go through? A typical patient of Delic.
Sure. So if George is coming in for a mental health treatment, so anxiety, depression, PTSD, the standard is a interventional treatment, which is 6 treatments over 3 weeks. So you'll come in twice a week for 3 weeks. That interventional treatment, what most people describe it is resetting your brain. So you essentially learn how to not think in a space of depression or anxiety or PTSD. You get out of it enough times, it knocks you out of it enough times that you can actually feel what it's like to not feel like that. And in terms of how it usually works, there is a booster treatment, which is a singular treatment once every 3 weeks to once every 3 months. And it's really dependent on you, George, or whoever the patient is, and if those symptoms come back, or if you have, a hard day, or it's the pandemic, or something happens, or, you get in a fight, or there's a lot of trigger points that put people back into fight or flight,
Sure.
the underlying condition that will re-trigger anxiety, depression, or PTSD. So that's kind of how the business works is we'll give people this interventional therapy. 73 to 74% of our patients are markedly improved. And then every 3 weeks to 3 months, they will come back for a booster treatment to ward off any recurrence of these symptoms.
You mentioned the pandemic. We've talked about it before. We thought it was going to come to an end when after the first couple times you and I spoke, as we were speaking the summer and the fall, and we thought that was kind of on its way out, but obviously hasn't happened. Are you finding that there's you're getting more and more calls. You're getting more and more. You got over 2,000 calls just from your event in Las Vegas. Are you finding that you're getting more and more calls because there are more and more people getting to a breaking point that, George might have had it all together 3-4 months ago, but even George now, for example, is starting to feel as if, hey, I may need some help here. Is that happening?
Yeah, it really is. It's the other pandemic, the mental health pandemic, as the Surgeon General said last month, right? I think there was very clearly, I'm smiling because it's gallows humor, right? You're just like, if you don't laugh, you cry. I think at this point, 2 years in, everyone's like, is this really not over?
Yeah,
Okay.
yeah.
All right.
You almost got to laugh about it a little bit. Otherwise, you could really spiral pretty quickly.
You really spiral, right? Exactly. If you can't laugh about it, you probably need one of our treatments. But yes, we have noticed a large increase over the last 6 months in people who are just searching for new ways to cope with this new normal, right? And I think it everybody in the world right now is going through some form of trauma that will cause some form of anxiety for sure, and maybe some depression and certainly some PTSD. So I think in terms of conditions that are called for, it's definitely hitting the mark for people who need treatment. I think we've seen a large uptick in the folks calling into our hotline looking for new modalities to treat themselves because things aren't working, whether it's talk therapy or current pharmaceuticals. It's just not working, and that's understandable because it's a little crazy. So you just gotta deal with it, and life keeps moving even if shit's crazy. So people have to find ways to cope, and that's where I think we fit in really well.
Well, I'll end with this, Matt, because we could talk about this for a couple of hours easy. But I'll end with this. On the one hand, it's terrible that the pandemic continues and driving more and more people to the point where they're going to need help. But I'm thankful that we've got Delic clinics, and there are some there are real treatments, real therapies out there for people to get help. Godspeed and how you get to those 100 clinics and how fast you can get to those 100 clinics, so more and more people can get help. But in the meantime, as a shareholder and as a human being, we can't help but love Delic, and I think I speak on behalf of everybody when I say that. Last words to you before we sign off.
Yeah, well, thank you so much for having me on, and I think that's right. I think our mission is to really heal the planet, right? We want to help heal the mental health pandemic, and I don't think we could have come about at a better time. No. Honestly, I think it's just necessary. I wish it wasn't so necessary, but it is. And so, when people need that help, we're here to provide it. And we really love that we can do that. And as the Harris poll said, more and more people are looking for this. So, we think we're just part of a giant growing wave.
Matt, thanks for joining us today. Congratulations on the success to date for Delic, and can't wait to see what you guys are going to pull off in 2022. And I'm sure we're going to have you back quite a bit in the next few months.
Thank you so much, George. Have a great day.
For everybody at home, you've been watching or you've been listening by podcast on Spotify, Google, Apple, your favorite podcast platform, to Matt Stang, CEO of Delic Holdings, trades in Canada under DELC, for French invest under DELCF. To do your due diligence, if you're about the company for the first time, get to the profile page on Agoracom. We know that psychedelics are new. We know there are a lot of different elements to them. So we've got the Delic story there in a nice, neat summary so you can understand it, get that 1,000-foot view. And then when you're ready from there, hop over to the Delic website, do your deep dive due diligence, because if you believe in the future of psychedelics, if you believe in the growing crisis that we have in mental health and wellness, then you've got to do your due diligence on Delic. Thanks for joining us. Have a great day. See you next time. Hey guys, this video is over, but don't forget to help your company by liking it and even leaving a comment below. And then don't forget to help yourself by subscribing to our channel and never missing another great Agoracom small cap video.